First, it's 100 days out from the Victorian state election. And the Premier Daniel Andrews has done something today that clearly indicates he is feeling the heat. Not just feeling the heat, but the opposition may have just given voters a legitimate reason for the first time in a long time to give up on Labor. And we touched on this briefly last night with the Liberal member for Kew, Tim Smith. The government continues to hemorrhage over its constant failings on hospital admissions and ambulance services. But despite all the cases, fatal cases at that, the polls have been showing that the bad news hasn't been enough to turn a significant number of votes the Liberal Party's way. But this week feels a lot different. The opposition leader, Matthew Guy, has been focusing the media's attention on a crucial trade-off. You can fix the hospital system once and for all by not spending billions of dollars on the suburban rail loop from Cheltenham to Werribee.
The priority at the moment should be rebuilding our health service, fixing the health service. So my priority isn't worrying about a rail loop from Cheltenham to Box Hill, it's about fixing the health service.
And today, the Liberals' argument was given quite incredible impetus by two major developments. Their prediction that the rail loop would cost taxpayers much more than $50 billion has proven to be correct by a long way. A comprehensive report by the Parliamentary Budget Office, which provides independent costings for MPs, discovered that the price tag was not $50 billion, but $125 billion to build. You add operating costs for 50 years and it reaches $200 billion. A total blowout before even one sleeper is laid.
Government's lying. They've lied from the start. They lied about the cost of this project. Now they've been caught out by their own Parliamentary Budget Office. They've lied about 4,000 ICU beds. They've lied about hotel quarantine. Who'd believe them now? They can't do both because the state can't afford $200 billion on a rail tunnel with maybe some scraps left over for the healthcare system. No way.
It is a solid argument. And then came another bombshell case of an elderly woman who'd suffered a stroke yesterday being forced to wait in a makeshift tent outside Box Hill Hospital for 17 hours. Her daughter Sarah broke the news to Neil Mitchell on 3AW.
These paramedics should be on the road, getting to people, not be nursing staff emptying urinals. I respect them 100%. I asked the paramedic last night, I said, how do we fix this? Because the paramedic said to me, he said, we're going to the tent. And I said, is that an upgrade? And he said, think Guantanamo Bay. And I said, this is just disgraceful that this is what it's come to. And I said, what is the answer? And he said, we need to stop building roads and we need to start building hospitals.
An upgrade to a tent for someone who suffered a stroke and then in the tent for 17 hours? They are kidding. So armed with the appalling news and the outrageous price tag for the rail loop, the Liberals were going full bore.
It's my local hospital, so people in my electorate, people in Manningham, from Doncaster to Templestowe, we rely on the Austin and the Box Hill. And what you see is a massive amount of overworked staff. They're overworked. They don't have the resources. Ambulance staff are manning a tent outside. How can that be in the year 2022?
And this is what tells me the Premier knows he's now being fried on this particular issue, that he knows his government is losing the health debate because he did something today he's been avoiding for many years, talking about the opposition and its policies. He directly addressed Matthew Guy's contention that the government should cancel a grossly expensive rail project to save lives.
Just imagine what our city is like without the city loop. You can't imagine. It would be complete chaos. Well, our suburbs need the suburban loop, and that's what we're getting on and delivering, the first stage of that. It's a big project, it takes time, it's what Victorians voted for.
That is a silly argument. You need it. You can have the loop, or can it, and where's the $125 billion you can use? Imagine what you could do with $125 billion. According to the Liberals, you could refurbish 20 hospitals, and the rest. Chairman Dan has been forced to go on the defensive on this and acknowledge a Liberal Party policy, something he never does. The Herald Sun in Melbourne is also jumping on the intersection of these two policies. It published a list today of what you could do with $125 billion. You could have 76,960 new nurses for 20 years, or 625,000 ambulances, or 74,600 paramedics for 20 years, or 66,800 maternity nurses for 20 years, or 59,790 doctors for 20 years. This afternoon, the Liberals took the fight up to the Health Minister over how many patients are being kept in hospital tents.
How many Victorian hospitals have tents established to manage patient overflow because underfunded emergency departments are full?
The premise of the question is completely wrong. Every patient that arrives at our hospital is under the care of a highly qualified paramedic or nurse or other clinician.
And again, this time in the House, the Premier was addressing the Liberal Party plan directly.
The point is, Speaker, you need to do more than one thing at a time in order to even pretend to be the government. If you need to invest in road and rail, nurses and teachers, hospitals and schools.
In one day. That very red face on Dan Andrews, by the way, is him being cooked slowly on this argument, because Victorians are fed up with having to rely on dysfunctional and dangerous third world hospital and ambulance services. And by targeting the massive expenditure required to build a 90-kilometre rail tunnel, Matthew Guy has forced the government into a corner. A government, mind you, which is already suffering from Australia's deepest pit of debt.